this is Dr. Earl with Denali Medical. To get us started, I'd like to ask you a question. Are you ready? I mean, really ready. Are you ready to find solutions? Are you ready to find root source healing? If you are, well, let's go.
Chances are you or someone you know has knee pain. Is it you? Maybe someone you know? Either way, by watching this video, you'll be able to help yourself or someone else. Are you ready to get started? Today I have with me Dr. Earl. He is the owner of Denali Medical and has been a part of emergency medicine for 16 years, as well as regenerative medicine for another 12 years. He lectures nationally on regenerative medicine yearly. And today we are going to be talking about cartilage and meniscus pain within the knee. How are you today, Dr. Earl?
I'm doing great, thanks. Thanks for having me.
Good. Glad to have you. So I guess to start us off, what is a meniscus tear? Could you fill us in a little on that?
Yeah, so let's start by describing the meniscus and or the cartilage. So those are the same things. The cartilage is actually a cushion, if you will, that's in between the bones of the knees. Each bone, the femur from the top and the tibia from the bottom, produce their own layer of cartilage. And then that cartilage interacts, and that's what slides across to each other so that we have smooth motion as we bend and use our knee on a daily basis.
That makes sense. And usually this tends to be a problem. Why is that?
Well, if it's torn or worn, then what happens is it doesn't rub correctly, and the result usually is pain. Interestingly enough, sometimes we won't have pain until the cartilage is completely gone, or there's changes that occur outside of that. It just depends upon how your neurological system is set up. But the reality is, if it's not functioning correctly, it can lead to further decay and breakdown, and it's important to get it taken care of.
Wow, that sounds pretty intense. Is there any options for care on any type of tear like that?
So the big issue with a tear is that it needs to either be repaired, repair itself, or some of the options are surgical. The challenge is with surgery, they simply grind it out and cut it down. And sometimes if they can loosen it enough, they'll fold it over, but then you're left with, instead of a tear, you're left with a bump that again, then they need to often grind down. Surgery can be an option, and I'm not opposed to that if it's absolutely necessary. But we have such great success in kickstarting the body's natural healing process to repair the tear on its own that it's a much better option. That also plays for cartilage that is worn down. So again, meniscus and cartilage, exactly the same thing. They just talk about it differently depending upon your diagnosis.
That makes sense. So I guess that would lead up to, can Denali provide anything to help with those issues?
Yeah, the treatments at Denali are specifically designed to really help repair the cartilage. And I shouldn't say the treatments are designed to do that. The reality is your body is the miracle. Your body is designed to do this. It just needs to be kickstarted. We have two treatments that are amazing for cartilage that's been worn, arthritis in that area, and or meniscus tears. The first is RenuO2. That's a combination of medications and then oxygen and excited oxygen that we place directly into the joint in order to kickstart the body's natural healing process. And then the second treatment that we have is PRPO2, so that's platelet-rich plasma combined with oxygen and excited oxygen in order to kickstart your body's natural regenerative process. And the technique is really quite comfortable. We're able to use a very comfortable introduction technique into the joints, and the body does really well.
Well, it sounds like a great way to kind of alleviate any of that pain you have. So with that being said, how does it compare with some of the other alternatives like surgery out there?
Well, so surgery, obviously the option is to go in and cut that tissue out, smooth it down by grinding the tissue. The challenge with that is you're left with scar tissue and you're left with less meniscus and or less cartilage. And over time, that means that ultimately it will either need to be replaced or you'll have to have a complete knee replacement, which if the knee replacements work, they're amazing. The challenge is that not all of them work, and then you're left with some significant challenges and problems for a long period of time. The second option that's often talked about is cortisone. Cortisone shots have been used widely throughout medicine. The problem there is the fact that you actually get 8% bone loss with each injection, and it actually causes a stretching of the ligaments and the tendons around that area. It actually breaks down this cartilage, it breaks down the other collagen-based tissue that's in the area. So tendons and ligaments become stretchy, and the long-term result is worsening, not improvement. So it doesn't necessarily build the tissue, it tries to break down the inflammation, and in the process, it breaks down a lot of the other tissues. Then you're obviously looking at something very expensive like stem cell. Stem cell is going to be amazing, but it's not there yet. Stem cell has about a 40 to 60% success rate and can be very expensive. The nice thing about RenuO2 and PRPO2 is the fact that we have a very high success rate, and it kickstarts the body's natural healing process. So limitations as far as, patients ask, what can I do after the injections? The reality is they can go about normal life because we want the body to respond to normal life and build and repair the tissue. Our bodies are designed to do it. We just need to help.
Yes, we are. Well, I guess on that note, what would make it so that you qualify for such treatment?
The first thing to understand that is if you have a complete rupture of tendons or ligaments, so not just a tear is a partial disruption, but if you have complete disruption of those tissues, they will act like rubber bands, and so they'll shrink back, and that means that they won't grow back on their own, and they need to be surgically repaired. For the most part, otherwise, RenuO2 and PRPO2 can help. It helps with broken bones, it helps with meniscus tears, it helps with a lot of those often more difficult injuries. As far as that's concerned, the only other qualification is you need to be willing to get well.
And who wouldn't want to get well? So I guess who would be one to consider such treatments from Denali, like the PRPO2 and the RenuO2?
Well, the first thing to understand is that the body is a miracle, and you have to believe that. It really is. And I often tell patients the instruction manual, the DNA that put us all together is still in there. So, and I remember when I was a young child, I would do crazy things. And the reality is my body would repair and recover because the DNA was still active. Well, DNA can be reactivated. They're showing that on a significant basis. In fact, interestingly enough, a big study out of Duke University with tens of thousands of patients revealed that, yes, our bodies can regenerate those tissues. And for years, throughout the community, the medical community, we said that they cannot be. Well, Duke University, big, reputable university, proved that, yes, we can. And we've known that for a long period of time. But now we have the backing of a very significant research article that proves that to be the case.
That is amazing. It's something that I would love to find out for myself. With that being said, where would I go to if I wanted to find out more information for any of those treatments?
So obviously you can go to denalimed.com. You can also look at Duke University's research by Googling that. You can also look at one of the more interesting scientific tidbits is the fact that the Nobel Peace Prize was given in 2019 to a team that revealed that oxygen activates 300 genes inside your DNA to regenerate and renew your body's own tissues. 300 genes. That's huge.
That is huge. Well, I guess on that note, if I wanted to find out more, or if you wanted to find out more, you could always go to denalimed.com, correct?
denalimed.com. Yep. You'll find our office number, you'll find some additional information, and then you'll be able to schedule online your appointment to find out more.
Sounds good. Well, I hope you enjoyed this video. I know I did, and I did learn a lot as well. For more information on your knee pain, please feel free to visit denalimed.com, and we'd be happy to answer any questions for you.
Okay, at the beginning of this lecture, I asked you, are you ready? Are you ready? And we're going to close with that same question. Are you ready? If you are, let's go.